Laura Gousset, who's also a physical therapist. She is currently working as a Chief Clinical Officer of LSVT Big for LSVT Global. So we are both have many years of experience working with patients with Parkinson's disease, and we're really excited that you're going to be here with us today. Next slide. And this is just biographies for both of us that you probably have in your handouts. We want to tell you that both of us do receive money from LSVT Big for webinars and for travel and presenting workshops. And we also have a non-financial relationship, meaning that we have a preference for LSVT Big as a technique for treating patients with Parkinson's disease. We find that it's just an amazing treatment, and for me, in 40 years of being a physical therapist, I don't think I've ever seen anything that has such a significant impact on patients' functions and quality of life. Next slide. We will be using a number of videos in this presentation, and we want you to know that all the clients that are shown in the videos during this presentation have given their consent for these videos to be used, but videos are not viewed outside of this, or copying them is prohibited. So now we're going to talk about the learning experiences. So what we hope you'll get by the end of this is that you'll be able to identify some of your own triggers for freezing. So what are those things that cause you to stop and hesitate and be unable to move forward? We hope that you'll be able to recognize other situations where freezing can occur besides gait. Patients can experience freezing in talking and lifting objects, in eating, in getting dressed. We hope that you'll be aware of how LSVT Big treatment can be tailored to treat those freezing issues, so how therapists can incorporate those triggers into treatment sessions to help you get over that freezing episode. And we hope you'll understand the role of sensory calibration in the treatment of freezing issues. So with that said, we'll move on to the next slide. It's really been an awesome time to be in rehabilitation because science has caught up with the value of exercise. So we've always known that exercise was extremely important for the musculoskeletal and cardiovascular system, but we also now know that exercise has an impact on the brain. And so through research, they've been able to identify those key principles of exercise that actually drive activity-dependent neuroplasticity. And what that means is that it actually can drive changes in your brain. So we know that exercise can improve brain functioning, and we think that it may actually slow disease progression. So we can honestly say that in addition to drugs and surgery, exercise is medicine, and it's a therapeutic option for patients with Parkinson's. Next slide. So these are typically how patients with Parkinson's are treated. They're typically given some form of pharmacological medication like levodopa, carbidopa, commonly known as Sinemet. Many patients have had deep brain stimulation. And now what we're saying is that while you can be optimized on your medication and further improve your function with deep brain stimulation, both of those can be made better, and your functioning and quality of life can be made better with both voice and body exercise. There is 25+ years of research to support that statement. So we know that exercise, both voice and body exercise, are extremely important in the recovery and improving function to help you relieve symptom relief and help you move forward. Next slide. We want to be able to show you what an impact LSVT Big can have on patients' gait. What you're going to see in this next video is Bernie, who's 71 years old and who was diagnosed with Parkinson's disease in 1994. He was referred to physical therapy because he was having difficulty walking, he had a history of falls, and he had some freezing episodes. He was optimized on his medications, and he was honing yard stage 3, which means he had his both arms and both sides of his body were affected, and his trunk was affected, but he was able to be independent and walking on his own. So this next slide, you're going to see the video of Bernie. There's no audio, so I'm going to talk over it. Okay, so If on the left-hand side of the screen, you'll see Bernie before he had LSVT big treatment. On the right-hand side of the screen, you'll see Bernie post-LSVT big treatment. So the first thing you're going to notice is that Bernie is no longer using a cane when he's walking. You'll also notice on the left-hand side, as he approaches the carpet in the doorway, he experiences some episodes of freezing. Also, when he encounters another person walking by him, he hesitates a little bit when he's walking. And again, he has difficulty getting started. But on the right-hand side, you can see how post-LSVT big treatment, he was able to walk right through that doorway, down the ramp, and keep going out to his car. On the left, again, you can see still he's taking very small steps compared to those steps he's taking on the right. He has a nice smooth gait on the right-hand side as opposed to the left. Okay. So when Bernie came to physical therapy, he was falling once and twice a month, and when he finished LSVT big, he had no more falls. You saw in the video that he was initially using a cane for ambulation, but after LSVT big, he no longer needed it. From the slide, you can see that his gait velocity improved significantly, and that once he finished LSVT big, he was at 100% of his age-matched norms, meaning that he had the same gait speed that people his age had, and that his overall endurance improved from 730 feet to 1,200 feet. So his goals were to improve his walking, to go to the movies, to play with his grandchildren, and to go out for dinner with family and friends, and he was able to accomplish all of them, being seen 4 days a week for 4 weeks. Next slide, please. So LSVT big is an amplitude-based exercise program for the limb motor system. It involves re-education of the sensory motor system, and the fundamental treatments are based on difficulties that patients with Parkinson's disease typically have, bradykinesia and hypokinesia. It's a unique treatment because it's based on the principles of neuroplasticity, so how do we go ahead and make changes in the brain? And it's also unique because it's research-based. It's had over 25 years of research behind it to prove its efficacy. Next slide. It's based on the principles of LSVT Loud, which is an intensive amplitude-based exercise program for the speech motor system. So many patients with Parkinson's disease will experience freezing both in their speech when they begin to have stuttering sounds, and also in their gait and in their activities of daily living. So what are the fundamental principles of LSVT big? Next slide. Again, it's a standardized, research-based, specific protocol for patients with Parkinson's disease, and its target is bigness. We're focusing only on getting patients to move bigger, move their arms bigger, move their legs bigger, write bigger, talk bigger. The mode of treatment is intensity and high effort. So we ask patients to be seen 4 days a week for 4 weeks, and when they're with us and working with us, we ask them to work very, very hard, probably harder than most people can imagine. So if we were asking you to work on an effort scale of 0 to 10, we'd want you to be working at 7 to 9, that whole 60 minutes that you're with that therapist. And the goal of LSVT big is calibration, and that means that you're using your bigger movements in all areas of your life. So you'll be using them in the home, you'll be using them in the grocery store, and any areas that you go out for dinner, all those things. And calibration helps to address those sensory losses that patients with Parkinson's experience. It helps to get you to internal cue yourself, and it addresses some of those neuropsychological changes that you might have been experiencing. Next slide. This is a graphic that a patient with Parkinson's disease who came to one of our workshops gave to one of the trainers at the end of the session. And you can see that on the left-hand side, the patient is feeling kind of small. He's shuffling his feet. He looks kind of unhappy. After 45 minutes of working with the newly certified trainers, his stride length is better. He's got a big smile on his face. His arms and legs are moving much larger, and it actually looks like he actually grew some hair. We don't guarantee that, but it looks like he did in this picture. All of this with the focus on simply amplitude, moving bigger, so getting you to do everything in a bigger way. Okay, next slide, please. LSVT is big is unique because it targets that hypokinesia and bradykinesia that patients experience, the small movements and the slow movements. These small and slow movements tend to be present at the time of diagnosis. Patients who move more slowly and have smaller movements, cells in your brain that produce dopamine tend to have lost more with people who show greater signs of slowness and smallness. And it correlates with disease progression. So as you progress in the disease and lose more of those cells, then you tend to have smaller and smaller movements. And it's generalized across the motor systems. Next slide, please. So the mode of delivery for this treatment is it has to be done by a certified physical or occupational therapist. It's a one-on-one intervention. It's not a group participation experience. So you'd be seeing your therapist 4 consecutive days of the week for 4 weeks. That's 16 sessions in 1 month for 60 minutes for each session. Every day you'd be given a carryover assignment, which is something that you'll do so that you'll use your bigger movements out in public. And then you'll also be doing daily homework, 30 days for the entire month, and you'll do the exercises for the rest of your life. Next slide, please. I think the biggest thing for me as a physical therapist in working with LSVT Big and patients with Parkinson's disease is that for the first time I actually see patients get better. So people with Parkinson's disease can get better. You have to push yourself as hard as you can. You get reinforced and motivated by doing better and by completing activities that you haven't previously been able to complete. And when you do that, it empowers you with the potential to do more. So I think this is an amazing treatment. I think everybody with Parkinson's deserves a shot at it because if you push yourself and if you put in high effort, you will make improvements. And with the saying we like to say, next slide please. We like to say, don't practice until you get it right. Practice until you can't get it wrong. So one of the principles in LSVT Big is repetition. So we're going to ask you to repeat an activity over and over and over again until you can't get it wrong. And that's one of the keys to overcoming episodes of freezing as well. Next slide, please. So calibration is the goal of treatment. What we know from research is that patients with Parkinson's disease have a mismatch in their perception of how they move and how others perceive it. So patients with Parkinson's disease tend to think that their voice is just as loud as everybody else's, but that people around them have hearing losses. They also tend to think that they're moving and walking just as fast and taking as big as steps as others, until they see themselves on videos. So often they have said, I had no idea how small my world had become. And yet when we ask them to move big, their comment is, I can't move like this. People will think I'm crazy. So what we do is work to calibrate them, to make them understand how big or small their movements really are. So calibration is when what your tool is measuring actually is measuring the correct thing. So in this picture, there's a man on a slide who probably weighs well over 150 pounds, and yet his scale is showing he only weighs 84. So this is a mismatch or a miscalibration. So our goal is to get patients with Parkinson's disease to put out enough energy and effort to move as big as normal. Next slide, please. And if you could put the whole slide up, that'd be great. So the treatment focuses on getting patients to move larger. So if you increase your amplitude of motor output, that's at the bottom of the slide, it produces bigger movements. And if you see those bigger movements and you're aware of how big those movements are and how much effort is required to produce a normal movement, then you begin to self-cue and say, oh, that was too small. And so once you do that, you can move normally. So the goal of the treatment is to get patients to move as large as they possibly can. We increase the amplitude of motor output, it produces larger movements, and then the patient is aware that they need those larger efforts and that bigger movement in order to move normally. They learn to self-cue, and then they put out bigger movements. Next slide, please. So this slide is just a summary of what the treatment session, typical treatment session looks like. There are 7 maximum daily exercises, and there are 5 functional components. So after you do the 7 maximal daily exercises, we would ask that you do 5 functional component activities. Those are things that are important to you, simple one-step tasks, things like sitting to standing, which we all do 100 times a day, getting in and out of the car, going to the table to eat, watching TV, getting up for snacks, opening a cell phone, if it's a flip phone, reaching into your pocket for keys or your wallet, reaching up on the cabinets to get a coffee cup. We do those kinds of simple tasks every day, and so you'd be identifying 5 that are important to you in your daily activities. Then each patient has 1 or 2 long-term goals that they work on, like getting in and out of bed to go to the bathroom at night, or maybe playing golf again with friends, getting in and out of a car. And so we build complexity over the 4 weeks. So we make things harder and harder for you, both in the exercises that we do, in the functional components, and in those hierarchies. So for example, the first week, if you're getting in and out of bed is your goal, the first week we just work on lying down and sitting up, maybe then sitting up and standing, maybe then standing and walking, and then at the end of the 4 weeks we put it all together, have you in a dark room with a blanket, and actually implement some of those real-world obstacles that you'll be facing. The last part of every treatment session is walking big. We get you to walk around corners, we get you to turn and stop, we get you to walk slow and fast and turn your head, all of those things so that we can help you to walk better in a more normal and a safe manner. Okay, that's an overview of what LSVT Big is. So I'm now going to turn this over to Laura Gousset, who will talk to you specifically about freezing.
Hi, thank you for joining us today. Like Beth said, my name is Laura and I'm a physical therapist, and I have worked with many patients who have had mild to severe difficulties with freezing, and I know how problematic it can be. And it's really exciting for me to share with you some ideas of how LSVT Big can be used to address some of these freezing issues. So sometimes people say, what causes freezing in Parkinson's disease? And really it's quite complex. It's been studied scientifically and continues to do so, but really it's not completely understood because of the complex nature of our brain. What they have observed in people who had to have difficulties with freezing is that they actually have atrophy, which is a fancy word for meaning shrinkage, of parts of the brain, particularly the frontal lobe and the parietal lobe and the gray matter. They've also found that people that have increased issues with freezing of gait, and that's what FOG stands for actually, is freezing of gait, is that they have increased difficulties with executive functions and perception. And that corresponds with damage to those particular parts of the brain, the frontal lobe and the parietal lobe. So we'll go to the next slide. So clinically, because of that pathology that occurs in the brain as a result of Parkinson's disease, we see a number of different things happening. People experience freezing in different ways. Some people say, my feet feel like they're glued to the floor or cemented, and other people have difficulty stopping movement once they initiate it. So in the brain, we say that one of the things that happens is this get ready signal is too weak, and so that persons aren't prepared for movement or prepared for action. That can affect reaction time, and clinically we see this slowness of movement called bradykinesia, and hypokinesia is smallness of movement. Secondly, we see that what we call a go signal is too weak. And clinically, what we see as physical therapists is our patients make comments that I get out of a chair, but it's difficult for me to take that first step. I have to stand there. I have to rock back and forth. I have to count. I have to tap my leg. They have to do something to activate their body to make that first movement. And sometimes it occurs with getting out of bed. They freeze when they want to go from sitting to standing. So that go signal can interfere with all types of different movement. And then the third situation, which can be quite troubling and scary for people, is when the no-go signal is too weak. And these are typically people that come into the clinic, and the spouse comes into therapy and is very terrified because they say, you know, it's walking with his walker, or maybe not even with a walker, and pretty soon it looks like he's running. It looks like his top half is going faster than his lower half, and indeed it can cause falls and cause safety implications as well. We also see it commonly when people are turning to approach a chair. Sometimes they turn and sit too soon, causing them to land on the floor instead of sitting on the chair as they had intended to do so. So we'll go to the next slide. So as a review, that freezing is both problem with a weak go signal and a weak no-go signal in the brain. It doesn't just occur with walking or what we call gait, but it can also occur with activities of daily living like dressing or feeding oneself, and also with speech. When it does occur with gait, it often leads to falls and related injuries. In fact, we know that the rate of falling in people with Parkinson's is fairly high. There's a wide range of reports, anywhere between 38 to 70% of people with Parkinson's fall every year. Freezing is more likely to occur in more advanced stages of Parkinson's disease, or during times when medications are in their wearing off cycle, when people are fatigued, and also when people are anxious or around others. DBS oftentimes doesn't help freezing, and in fact people with DBS can fall more and have more balance issues, and so medical management of freezing issues doesn't fully cover those issues. So go to the next slide. So traditionally, what physical therapists do to help people walk better that have freezing of gait issues is to provide some sort of an external cue, such as a visual cue of putting marked lines on the floor. Lots of times people that have freezing issues say, well, I can't understand why I can walk, I have freezing issues when I walk down the hallway, but I can walk up and down the stairs just fine without any freezing. And the edge of that step is like a visual cue to step over and to trigger the correct size of a step. And the same thing happens if you were to put strips of masking tape all the way across the floor. It becomes a visual cue for a person to step over and can reduce their freezing. The problem is that our world isn't lined automatically with tape lines on the floor, and so really it doesn't work well except in really small spaces in the home where freezing can be a consistent problem. Some people use laser pointers that they shine them on the floor and try to step on the red dot on the floor, and that can be helpful sometimes in reducing freezing. They make special walkers called U-step walkers that have a laser beam built in, and that again is a visual cue of step over the line, and that can reduce some freezing issues. External verbal cueing is sometimes used to remind people to take bigger steps. Visualization of walking, looking through doorways, sometimes initiating movements with rocking can help, and also metronome and music therapy is sometimes suggested as well. And all of these approaches are found in the literature. So we'll go to the next slide. So when a person comes in to receive LSVT BIG, as Beth described, the first thing we do before we do treatment is to do a thorough evaluation. And the most important thing to do first as a therapist is to see when does the freezing occur. And during walking or gait, we know that there's a lot of typical triggers. A lot of people have difficulty starting their walking. We call that start hesitation. Turning in place is a very, very common freezing trigger where people take multiple tiny steps instead of a normal maybe 4 to 6 steps to turn in place. Or a person walks fine down corridor, but when he goes to change directions, the freezing can occur. Backing up certainly is a frequent freezing trigger, even backing up a couple of steps to approach to a chair. Approaching other obstacles, going through narrow passages, which is very common in most people's homes and apartments and condominiums, going through narrow hallways, doorways, elevators, anything that has confined space can trigger freezing. Changing terrain, going, for instance, from carpet to tile or tile to carpet. Distractions can cause freezing, and also crowded environments. And so for some of my patients, they have freezing of gait issues with all of these different situations. And some of my patients say, you know, I can do all of those things. It's really just when I do one of these things, perhaps backing up, that I experience freezing. So that's the first thing that we do, is say, when does the freezing occur? We'll go to the next slide. I've also had patients that freeze during activities of daily living. I had one gentleman I saw once that was very troubled because he was having difficulty eating. He would get his fork about 2/3 of the way to his mouth and he would freeze, and had difficulty completing that movement so that he could feed himself. It can also occur during toileting tasks as listed there, during transfers, getting in and out of bed, rolling, repositioning. Really, if it involves movement, then freezing can occur. We'll go to the next slide. So what I tell my patients is it's really important to understand and identify when the freezing occurs so that you can be prepared ahead of time to keep your movements big before you encounter that freezing trigger. So Benjamin Franklin said an ounce of prevention is worth a pound of cure. Now, we can't completely prevent freezing from happening 100% of the time, but if my patient knows that every single time I go through the doorway into the bathroom, which is exceptionally narrow, I freeze, then we can specifically work on that task during therapy so that the patient proactively recognizes that, hey, I'm going to keep my steps big all the way through the doorway because I realize if I don't focus on that, I'm going to freeze when I get to the doorway. So next slide. So the bottom line is you have to think big all the time, even more so if you have difficulties with freezing issues. We'll go to the next slide. So during the LSVT big treatment session, this is a snapshot of the protocol that Beth showed you and explained, so I'm not going to go in great detail other than to say during the maximal daily exercises we teach you how to generate or to produce bigger movements. But really for people that freeze, the most important part of the treatment is this functional section called functional component tasks, walking, and hierarchy that are customized to your individual freezing issues. Go to the next slide. So for example, if you have difficulty getting through a doorway, that's your freezing trigger, we might choose that as a functional component task. And over the course of a month, we would probably practice that stepping through the doorway with a big step at least 300 times. And after so much repetition, it becomes what we call a hook or a cue to help you to remember to use your big movements in big effort in everyday life. So we want you to overlearn that simple task of sitting to standing, going through the doorway, whatever it is that involves freezing, so that you can carry over to everyday life and to other situations where you might experience freezing. We go to the next slide. So those functional component tasks are just simple motoric tasks. They're one-step things. So some examples that could incorporate freezing issues would be doing a quarter turn, sitting to standing, standing and taking that first step for people that have start hesitation, stepping through a doorway, which I just talked about. Maybe it's turning to approach a chair if you're a person that tends to sit prematurely, or reaching and stepping back. We'll go to the next slide. So this is a video I'm going to show you of a gentleman that has Parkinson's disease and steps. He doesn't freeze, but he steps with very small steps. Go ahead and play it. The video might be a little bit choppy for you. What we see in this video is that this man steps in small steps. It probably takes him at least 10 steps to turn in place, whereas normal takes 4 steps. Because of the progression of Parkinson's disease, as this goes on, he could be one that eventually has difficulties freezing when he tries to turn in place. We'll go to the next slide. So what we do in therapy is work specifically on 90-degree quarter turns. And here's a video of one of my patients doing so. Go ahead and play that. So we work on big steps so that she's able to turn in place in no more than 8 steps, and hopefully less. So we practice it repetitively and very deliberately to improve her performance of that. And it can be very, very helpful and something that you can learn quickly. We'll go to the next slide. So the same thing occurs with activities of daily living. So for that gentleman that had difficulty with freezing when he was getting to his fork to the mouth, we simply practiced it repetitively. We practiced big movements of going all the way from the plate all the way to his mouth 5 times in a row during therapy, and he practiced it 5 times in a row at home. So you could do that with whichever functional component tasks that you and your therapist agree upon. Go to the next slide. The hierarchy tasks are those more complex tasks, also that are real-world tasks. So we really strive to identify what are the things that are difficult for you to do because of your Parkinson's and perhaps because of freezing issues, and also what are the things that you would like to either continue to do because you enjoy it, such as maybe going out to a restaurant or playing with your grandchildren, or is it something that you've had to give up because of your freezing issues or because of your other Parkinson's symptoms that you would like to do again? What we find with people is that, of course, if you work on something that is enjoyable and motivating to you, then you're more motivated to work on it and to practice, not just in therapy but at home too. We'll go to the next slide. So these hierarchy tasks are more complex tasks involving many different steps. Here's a few examples that you might identify with. One of them is a client that has difficulty going from the bedroom to the bathroom at night to use the toilet. And he finds that he tends to freeze in the doorway and also when he turns to approach the toilet. Another example would be someone that tends to freeze when he goes into a restaurant, when opening doors, walking through crowds, maneuvering around the tables. Those are all typical freezing triggers. And the last one was an example of a woman who would freeze when she was getting her mail. She froze when she entered and exited the elevator in the assisted living complex and when she was carrying the mail as well. So the therapist, the first thing they would do is say, well, why don't you show me how you do that task? And they would simulate your home environment as best as they could to really observe when those freezing issues happen so that they can work very specifically during treatment on your ability to conquer those freezing issues. Go to the next slide, please. So the same thing with activities of daily living. Here's an example of a person that would like to be able to toilet themselves more independently, but the person freezes when turning to approach the toilet, and also when taking that first step after getting up from the toilet. They have a hard time initiating that first step. We've also seen people that have difficulty dressing themselves, so they freeze when they walk to get their clothes out of the closet, and then they have to back up a couple of steps to exit the closet, causing freezing, and then lastly freezing when standing to pull the pants up. So it wasn't every single part of dressing or every single part of toileting that triggered freezing, but the therapist was a good detective and found out what were the specific problems with those hierarchies, so that those were the things that they could work on. We'll go to the next slide. So the last part of LSVT big treatment is gait training. And gait training is a fancy way of saying teaching you how to walk better and with less freezing. So initially during treatment we work on what we call a closed environment, and what that means is an environment where there's no obstacles, no real distraction, no changes in terrain, so that you can really focus and get comfortable with walking bigger without any distractions and without any freezing. As a person progresses, then we might progress towards changes in terrain or distractions or different types of environments. During the gait training we would also include some of those triggering situations, such as you progress, we might take you down a hall where there's others approaching you, and we might make you walk around obstacles and so on. Initially, we give patients a lot of verbal cueing to help them to remember to keep their movements big, to keep their steps big, to keep their posture big, so that freezing doesn't occur. As treatment progresses, because of the intensive and repetitive nature of LSVT big, the person who freezes tends to be able to internally cue themselves more over time. And so instead of us saying, keep it big, keep it big, keep it big, we become the little voice inside of your head that tells you to keep your steps big. So in more severe cases, we have had people that need additional support of one of those U-step walkers with a laser in it, or caregiver cueing. But I think in almost all instances we can reduce the frequency of freezing of gait episodes. The last thing that we work on is just sustaining the endurance of big walking, especially for people where fatigue is a freezing trigger. And so a lot of my patients come in and they can walk for a short distance, but as their medications wear off or during longer distances, they begin to have freezing of gait issues. And if we work on really building that endurance, we can get to the point where the patient can walk more functional distances needed for things like shopping and outings without having freezing occur so frequently. We'll go to the next slide. So this is a little video of a woman who had freezing issues at multiple points. And go ahead and play it, Beth, and we'll talk through it a little bit. We don't necessarily need sound on it. So the first thing that happens is that she just has a lot of difficulty getting up from the chair and starting that first step. So she has some start hesitation. And again, the video might be a little bit choppy for you, but she has to kind of rock back and forth a little bit to get that first step going. She walks across the room and she sees the chair and her body wants to sit in it, but she starts doing this reach and turn much too soon before she's on the chair. And when this happens, again, it can cause falls. Sometimes people sit in an uncomfortable position actually on the armrest. And so we really work on the bigness of turns and the bigness of that step over so that the person understands they have to get all the way in front of the chair before they sit. So she has some freezing here again at the end when she's trying to move her feet so that she's centered in front of the chair and able to sit down. Okay, let's just go to the next slide. So the LSVT big treatment protocol is a 4-week treatment protocol. Freezing issues certainly aren't conquered on day one. It takes lots of repetition and practice over the 4 weeks to get to the point where the patient feels like they have power over their freezing issues. Next slide. So on week 1 and week 2, we really try to not only work with a patient, but sometimes we need to work with a caregiver as well. And because sometimes the patient needs cues to think big before they encounter the trigger situation. I've had patients that tend to freeze every time they walk into the bathroom, and so if I also alert the caregiver to that, if you see your spouse getting up to go to the bathroom, just give him steps when you walk into the bathroom, because once the freezing episode starts, it becomes difficult to get out of that freezing. It's much easier to prevent the freezing episode. Sometimes you can use key think big signs in key areas. So if you know there's a particular spot in your home where you tend to freeze, you can pull up that next bullet point. You can certainly put a sign there. Repetition is key, and just keeping it simple is key too, especially if you're a caregiver. As LSVT big therapists, we really recommend you just give the cue of think big, because it's much more effective in training. Your therapist will also tailor some carryover assignments so that you can become more confident that freezing is not a problem that can't be defeated. Then on weeks 3 and week 4, your therapist is going to start adding in what we call dual task challenges or distractions. So if you get to the point where you're pretty good at walking down that hallway and turning and backing up and all sorts of things, and you're not freezing so much anymore, then they might start to say, now, can you carry this newspaper, or can you talk to me and keep your steps big without freezing? By the end of the 4th week, you should be able to complete that whole task without freezing in real life consistently. So for example, in that person that had a tendency to freeze every time that he got up to use the bathroom, especially every time when he walked through the doorway, we want by the end of treatment that he can do that whole thing, even at home, not just in therapy, without freezing. And then lastly, if freezing only occurs during wearing off times, we might actually do a session or 2 during those wearing off times to really work on the bigness of movement to prevent freezing from happening in those situations as well. So here are some tips from us, from the experts, that we found to be effective on the hundreds of patients that we've seen. Big posture is very, very important. People that freeze tend to be fearful of falling and look at the floor, but it's actually the worst thing that you can do and triggers freezing just by looking down. So if you have difficulties with freezing, be sure to look straight ahead when you're walking, going through doorways, turning, backing up, entering elevators, changes in terrain. We found that as soon as you look down on the floor, you're going to be much, much more likely to freeze. But if you look through the doorway, straight ahead, much less likely to freeze. The second one is we want you to take big steps. You should always be focusing on big steps, and if it doesn't feel too big, it's probably not big enough. It might be helpful to have people videotape you occasionally, just as your therapist does, to make sure that you are keeping it big enough. During those freezing times, like turning or backing up, you're going to have to use extra big steps, even though it's going to feel funny to you, if you really want to conquer freezing. The third one is focus. Always think big, think big, think big. And through treatment, we want to become that repetitive voice in your head that helps you to remember to use your big movements all the time. And then lastly, just remember to plan ahead. If you're in a hurry, you're going to be more likely to freeze. And so if you know that you have something important coming up for the morning, be sure and take extra time so that you're not in a rush and therefore not having freezing issues as much. Know that medications are important as well, and for those people that have freezing issues during your medication off time, if you have an important activity that you need to accomplish and you're worried about freezing during that activity, try to plan your medications accordingly. And then lastly, don't forget the importance of rest. Rest is really important. Exercise is extremely important in Parkinson's disease, but rest is too. And when you find that you're well rested at night, you'll have less freezing during the following day. If sleeping is an issue, we'd advise you to please talk to your doctor about that as well. We are going to email you a tip sheet called Tips and Tricks for Freezing that have some additional tips on conquering freezing as well. So remember, with LSVT Big, this sense of calibration is really at the heart of the matter. Just like Beth said, that scale wasn't calibrated correctly, it wasn't measuring correctly, we know that your brain isn't giving you the correct perception of how your movement is. There's several barriers to calibration. One is that people with Parkinson's don't perceive that their movements are too small. Go to the next slide. And movements that are normal actually feel too big. We know that there's problems with remembering to use bigger movements. A lot of my patients say during week 2 or week 3 of treatment, I know I should move big, but I just forget to. And lastly, there's some neuropsychological deficits. People with Parkinson's tend to have difficulty staying focused on using big movements, especially when they're distracted or doing two things at once, like talking and walking or carrying something and walking. Next slide. So the key steps to calibration during LSVT Big treatment is the first thing is that we help our patients recognize the need to use larger amplitude movements. One of the ways that we can do that is by showing you what your normal small movement looks like because of Parkinson's disease, and then how good your bigger movements look through videotaping. We show patients that bigger movements are really normal and have a positive impact on function. And that's so fun to do, and typically we show patients very immediately how they can get up out of the chair faster, more easily, and more independently just by making their movements bigger. And then thirdly, through treatment, we assure that patients are comfortable using their big movements in the real world. And that takes quite a bit of training and repetition to do so. So our goal through calibration, if you go to the next slide, is that you would not just perform good for us therapists in the treatment room, but by addressing these barriers, that this would become a permanent change in your behavior, that you would use your bigger movements and therefore more normal movements in everyday life, even after you're done with therapy. So, in a nutshell, our LSVT Big treatment goal is such, on the next slide, that people with Parkinson's disease will use their bigger movements automatically or habitually in everyday living, and that there will be long-term carryover for increased amplitude use. So, in summary, in order to successfully reduce the freezing issues in Parkinson's, we have to understand what are the specific triggers to you, because your freezing triggers are not the same as someone else's with Parkinson's. Because of that, we'll be able to tailor the LSVT Big treatment to address those specific freezing issues. We know that achieving calibration will require a lot of time and effort, and sometimes caregiver involvement if people have very severe freezing issues. But we want to leave you with the fact that there is hope, and that treating freezing issues with LSVT Big really can improve mobility and quality of life, independence with activities of daily living, and can also reduce falls and fall-related injuries. So there is a video on how to locate an LSVT Big clinician, but it's rather long, and I know our video playback hasn't been the best on all systems today. So if you do want to get started with LSVT Loud and LSVT Big, this is the best information we can give you on the next slide. It is typically covered by insurance. We haven't had any issues really with Medicare or other insurances to date, but you do need a referral for physical therapy. Usually it says LSVT Big on there. If you want to find a clinician in your area who's certified in LSVT Big, please go to our website, and there's a tab on the top called Find a Clinician. You can type in your zip code or your state and LSVT Big for physical therapy or LSVT Loud for the speech to find clinicians in your area. We also do have a DVD available called the LSVT Big Homework Helper DVD that you can find on our webpage or on Amazon.com, which will introduce you to the movements, or if you've gone through treatment already, it can be really helpful in helping you keep motivated with the exercises over time as well. We'll go to the next slide. So our final quote for you is, it is possible to take charge of your life even with Parkinson's, and it is possible for your will to override your brain, and it really is possible to have power over Parkinson's. And that was by Sharon Kaw, who was a graduate of both LSVT Loud and LSVT. We're going to take some time for questions. I know that we don't have a lot of time, but I'm happy to stay on for 10 minutes or more after the fact. And if you have additional questions, Beth will tell you how you can email us, and we can give you written email responses to your questions as well.
All right, great. Well, thanks to both of our presenters for covering all that wonderful content. And we would like to turn it over for questions from the audience now. So there are a few ways to ask your questions, and I'll go over that for anyone that joined us a little bit late. The first is to type in your question in the question box on your control panel. So to do that, click on the question box, type in your question, and then I'll see the text of your question, and I'll ask it out loud to our presenters. The second way would be to raise your hand, and you can do that by clicking on the hand icon on your control panel. I'll then see that you have a question. I'll unmute your microphone, and then I'll let you know that you're unmuted by calling out your first and last name, and you can ask your question out loud to the group. And then the third way is to email us, and I have that email address displayed. So that's info, as in information, info@lsvtglobal.com. And the experts can always answer any questions you have even after the webinar here today. So I haven't seen any questions come in thus far. I don't know if our presenters have any frequently asked questions that come up in your own practices that we could start with. Oh, I'm sorry, I do have one that came in. So, Laura, if you'd like to start with this one. If someone has freezing in many different areas, how do you know where to begin with their training?
I'm assuming that you might be a therapist joining us today, and so I'll talk to you as an LSVT Big clinician. So you may or may not be able to address those freezing issues during your gait training and your hierarchy training. Certainly during your gait training, or what we call big walking in LSVT Big, you can incorporate a lot of those freezing triggers into that time of treatment, specifically working on keeping the steps big so that the freezing doesn't occur during those triggering situations. Also, during the hierarchy training, you have the ability to incorporate a lot of those freezing triggers into the situation that you're working on. So that's my best advice to you. And what we hope is that the patient will learn the power of keeping their movements big so that they will be able to generalize that bigness to other facets or other activities where freezing may occur that you haven't specifically practiced during treatment.
Okay, great. Thanks, Laura. And Beth, if you'd like to take this next one, how effective is LSVT Big with patients who have dementia with Lewy body? And sorry, Beth, we're not able to hear you. I think your microphone might be muted. But if you're able to jump back on, how effective is this with patients who have dementia with Lewy body?
Right, thank you. Yes, it is effective. However, you will have to involve the caregiver in the care of the patient. They will need to provide cues to that individual as they approach each trigger for freezing. So I think it can be done. It's not going to be as effective as it would be with someone with idiopathic Parkinson's disease, but it can be and can be helpful, and certainly will involve the need of a caregiver or a partner to cue.
All right, great. Thank you, Beth. The next question, and I can go ahead and answer this one. How can we get the DVD in the United Kingdom? So the Homework Helper DVD is available either on our website, so lsvtglobal.com, under the Products tab, or it's also available at our Amazon store. So if you go to amazon.com and type in LSVT Big Homework Helper DVD, you'll be able to see that DVD. I'm also going to send an email to the group, and so I'll include the direct links to that product in case anyone's interested in ordering that. And the shipping options on Amazon are probably less expensive, especially if you're having it shipped internationally. So I'll include that link for both our Amazon store and our website. And then the second half of this question is, how do I find out qualified clinicians? So Laura was mentioning if you're looking for an LSVT Big certified clinician, that's either a physical therapist or occupational therapist who's been certified to deliver LSVT Big, you can find them on our website by going to lsvtglobal.com and clicking on Find a Clinician. Then you'll have the option of selecting either an LSVT Big certified clinician or LSVT Loud, which is our voice therapy program. So for LSVT Big, you would select the LSVT Big physical or occupational therapist, and then you can type in different search parameters, so either searching by zip code or city and state or a country, so that you can find a therapist near you. And then once you click search, you'll see a list of all the therapists who are available to deliver LSVT Big in your area. And then the next question, I'll turn it over to one of our experts. So Laura, if you want to go ahead and take this one. What is a realistic duration of therapy for someone with very low endurance so as not to fatigue them too much for the remainder of the day or the next day?
Did you say what's the typical, I didn't hear the first part of that?
Yes, what is the realistic duration of therapy for someone with very low endurance so as not to fatigue them too much for the remainder of the day or the next day?
Oh, okay. Yes, thank you. So the LSVT Big protocol is consistent. The duration of the treatment sessions is always 60 minutes long, and because of all of the repetition and intensity and all of the components that go into our LSVT Big treatment session, it really does take all of 60 minutes. Now, that said, I have worked with some very, very deconditioned persons, and what's important to do is to tailor LSVT Big treatment to each patient's current fitness level. And so we push the patients to their maximal intensity, and for some patients that appears to be lower than for some people that are very physically fit. What our patients find almost invariably is that they actually have more energy and feel better as a result of exercising, especially after the first week. We do see some fatigue in the first week of treatment, but after that the person starts to feel better, starts to sleep better at night, and gets all of those great benefits of exercise that you and I also benefit from when we start a fitness program. So I guess the question or the answer is that the treatment delivery and duration is consistent, but you do need to tailor it to each individual.
Okay, thanks Laura. So we just have a couple more questions. Beth, if you can take this next one. My freezing trigger is getting into bed. Do you have any suggestions to make that easier?
Absolutely. So practice, practice, practice is the key. So what you'll have to do is, with walking towards the bed, walk big towards the bed, look straight ahead, not down at the bed. Just practice first just walking towards the bed and then walking away big. Walk towards the bed, then walk away big. Then walk towards the bed and take big steps as you turn to sit on the bed, and then just repeat that. So repeat each of those steps consistently, and then pull the covers down and work the same way. So it sounds like you would benefit really from seeing an LSVT Big certified clinician to work on just that trigger freezer, that freezing trigger. So it could be part of your whole LSVT Big treatment if you haven't already received it. If you have received LSVT Big, I would recommend that you go back to your therapist for a tune-up so that you could work specifically on that task, and it will help carry over to other activities that you might want to do.
All right, great. Thank you, Beth. And Laura, if you'd like to take this last question, can you provide us some exercises for freezing of gait?
Yeah, well, again, kind of like Beth said, is that it's a lot more complicated than just giving a person a simple set of exercises. And so if you are having freezing issues, specifically with gait, we'd really recommend that you receive LSVT Big treatment. You need the intensity and the feedback and the specific skills and instruction of a therapist certified in LSVT Big. We are going to send you that tips and tricks for freezing that will give you some ideas of how to reduce the frequency of freezing and how to just begin to work on focusing on big steps, big posture every day whenever you're walking, even around your own home, and that in itself will help with those freezing tasks as well.
All right, great. Well, thank you to both of our presenters for presenting here today and answering some of these questions that have come in. I'll go ahead and send another email to the group of anyone that attended, and I'll include the handout from the slides today so you have that for your reference. And then I'll also include that tip sheet that Laura has mentioned during the webinar today. And again, if you have any other questions that come up, we're always happy to address those questions. So feel free to email us, info@lsvtglobal.com. We'll be scheduling some additional webinars for 2015, so stay tuned. We'll send an email once we have those scheduled, so hopefully we can have you tune in to another webinar after the new year. So thanks again, everybody. Have a great rest of your day, and we hope to see you again in the future. All right, take care.